I had infection, presumed infection in my upper left jaw where I'd had several extractions done, and I'd been having burning sensations in my face along this pathway here. I would get muscle tension that would run from my jaw up in a band through my temporalis and down to the muscles in the base of my skull. I would get migraine headaches, and in the mornings when I woke up, on the left side of my head, it felt like my left eye was bulging out. And lots of times I would get little bands of inflamed lymphatic vessels that I could push on, and they felt like little rubbery tubes going up around my temple. And my best guess was that I had some form of infection in my jaw that was causing all this inflammation and pain.
The popular word called cavitation is simply a medullary bone disease. I think what we found is this medullary bone disease is problematic because it's a routing of toxicity by the body. These stagnant areas in the body, I call them stagnant because they're not really working as hard as the other parts of the body are, so the body wants to tuck those toxins away, whether it be heavy metals or bacterial formation, or it could just be out and out infection that's there with bacterial content. So this medullary bone disease is easily located on a CBCT. Cone beam computerized tomography that we use can give us a grayscale number of the density of the medullary bone. That's valuable. But what's also valuable, of course, is a cavitat. We have a cavitat too.
Turn it around. Yep, good.
So once we've isolated where the cavitation is, and once we punch through to the cavitation site, then we want to go and ferret out as much of that toxicity as we can without disturbing the nerves or without punching through to the sinus if it's needless. We want to just embrace the toxins that are in that area.
He found 3 holes up in the cortical bone that he drilled out and sterilized and put some grafting in with fresh frozen plasma and the calcium triphosphate, and sewed me up and sent me on my way. And I'd had pretty significant symptoms. I felt like I was hungover every morning when I woke up, basically. And I woke up the next morning after having the surgery and didn't feel like that. Didn't feel like my left eye was bulging out of my head, which was kind of standard for me. Every morning I woke up, I felt like I had exophthalmos. I felt like my left eye was just bulging out of my face every morning. It took about an hour for that to go down. Didn't feel like that, and I haven't had a headache, and I haven't had any of those same symptoms since he did the surgery.
Cleaning out any soft material and adding ozone to the area properly, ozone water as well, ozone gas and ozone water, is extremely important. But it isn't more necessary than just cleaning up that bone interiorly that will go vertical into that socket, and we'll just do a light scraping on the bone to get blood flow. When we get that new regaining of the possibility of good, strong bone growth in that site in the next 4 to 6 months, why then that's a huge liftoff for the person. They'll realize a difference in the way they feel. Categorically, they feel better.
Coming down here to get this fixed solved problems that I've been dealing with for probably a decade in various forms. So the coming down here and driving down here and paying to get this done, the cost, the time, it was invaluable to me. I mean, it's been frustrating, to say it nicely, to deal with what I've been dealing with, and to finally have a way to stay on top of it now. Somebody who knew that there was, or could actually affirm that there was some form of infection or something in my jaw that was causing these problems. He's the 4th dentist I've been to. I've been to an ENT doctor, I've been to a neurologist, I've been to an oral surgeon, and it would have saved me thousands of dollars and thousands of hours of misery if I'd been down here earlier. You know, when you're constantly in pain, it takes away a part of your focus. You have to focus on that issue just because it's there and it's nagging you. So even if you're talking to somebody or you're trying to study, part of you is always focused on what's going on in your jaw and your neck and your swollen lymph nodes and the stiffness that's going down through your muscles and your SCM and all the muscles through your neck here. So as far as ability to focus and attention and productivity, it definitely knocked it down a significant amount.